Welcome back to your WISE Corner. Today, we're tackling a question I get from so many cancer patients and caregivers. How do I take time off from work for treatment without losing my job or income? If you live in Connecticut, the good news is you have both job protection and income replacement options. But the process can feel confusing. So today, I'm going to break it down step by step so you know exactly who to talk to, when, and how. Grab a notebook and pen because this is information you'll want to keep. There are two big categories we're talking about today. One, job protection. This makes sure your job is still there when you come back. Two, income replacement. This helps you still get paid while you're out. In Connecticut, these usually come from different programs. That's why you often need to apply for more than one thing. Let's start with job protection. Federal FMLA gives you up to 12 weeks unpaid leave with your job protected, as long as you've worked at your job for at least 12 months, 1,250 hours in the last year, and your employer has at least 50 employees. Connecticut FMLA is even broader. If you've worked for your employer for just 3 months, you could be eligible, and it applies to most employers in the state. With both, your employer must also keep your health insurance going while you're out. But remember, FMLA doesn't pay you. That's where income replacement comes in. For income, here's what's available in Connecticut. CT paid leave. This is a state program you apply to yourself, not your employer. It can replace a portion of your wages for up to 12 weeks. Short-term disability. This is private insurance that some employers offer. If you have it, you'll apply through your HR or directly to the insurance company. Here is an important tip. CT paid leave does not protect your job, so you'll usually apply for CT paid leave and FMLA at the same time. Here's the timeline I recommend. 1. As soon as you know your treatment plan, contact your HR or benefits department. Tell them you'll need time off for a serious health condition. 2. Get the forms. HR will give you FMLA and or CT FMLA paperwork. The CT Paid Leave Authority has its own online application. 3. See your healthcare provider. They'll complete the medical certification forms for your leave and benefits. Apply for CT Paid Leave. Do this right away if you want wage replacement. 5. Apply for short-term disability. If your employer offers it, submit forms to the insurer. 6. Keep HR updated. If your treatment schedule changes, let them know quickly. Here is a pro tip. Employers in Connecticut have to give you at least 15 days to return your medical forms, but the sooner you submit them, the smoother your leave will be. Your employer may also offer other supports. Employee Assistance Program. EAP for counseling or stress management, flexible work arrangements or a phased return, workplace accommodations under the Americans with Disabilities Act, ADA, like adjusted schedules or work from home days during treatment. These aren't just nice to haves. They can make a huge difference in your quality of life during treatment. If this feels overwhelming, start with just one call to your HR or benefits department. Tell them, I've been diagnosed with a serious health condition and I'd like to know what leave and benefits are available. They should guide you on what's next, but you can also get help from CT Paid Leave Authority for wage replacement questions, CT Department of Labor for job protection questions, Job Accommodation Network for workplace adjustments, Triage Cancer for cancer-specific employment and legal resources. Remember, taking time off for treatment is not a favor, it's your right. You've worked hard, and these programs are here to support you through this chapter of your life. If you found this helpful, subscribe to Dr. Wendee's Wise Corner and share this video with someone who might need it. You are not alone, and you have more options than you may think.